to discuss several matters, namely matters related to COVID-19. As you know, over the past 2 days, um, local cases of COVID-19 were registered. The thing that confirms our concerns, in fact, the concerns that we have always reiterated, that threat is still there, the pandemic is there, and we all need to comply with preventive and safety measures. This is a necessity and a duty, and this is our only way out of this pandemic. And as you all know, we now at the medium threat level, we refer to it as the blue alert code. However, in the context of the increase in the local cases of COVID-19, we might need to regress to the significant threat level, the yellow alert code, which requires imposing a comprehensive lockdown during the weekend and increasing the curfew hours and also reducing the number of industries reopened. If more than 10 local cases were registered every day for 7 days in a row, and we hope that we will not have to do this. What I would like to reiterate is the importance of compliance with safety and preventive measures, wearing masks, maintaining physical distances, and the law shall be applied against enterprises that do not comply with this and do not make their staff or customers comply with preventive measures, noting that penalties mount to the level of closing down the enterprises. Thousands of enterprises were closed down because of this. The Ministers' Council yesterday conducted a meeting chaired by the Prime Minister, where we discussed a number of matters related to COVID-19 crisis and the work mechanism of some industries that are still shut down. During the meeting, we considered the summer term in Jordanian universities, now that we are at the blue alert code, according to the matrix that we announced in relation to the stages of COVID-19. This blue alert code does not allow universities and colleges and kindergartens to operate. The Ministers' Council approved a set of measures related to the summer term. It allows the return of some university students, the students of graduate studies, students of medical college of medicine 4th and 5th years, and the students of dentistry 4th and 5th year, and the students of some applied specialization. The rest are going to study remotely. Exams are going to be in writing on campus for those allowed to be on campus. Otherwise, it will be electronic, according to the nature of the specialization and the courses being studied. And the Ministry of Higher Education shall announce the details of these decisions. We also, during the Ministers' Council meeting yesterday, we discussed the methods of recovery for a number of essential industries that are essential to the national economy, including agriculture, tourism, and transport. And there will be decision taken in this regard, and we shall announce these decisions once we take them and once we discuss the recommendations with the respective industries. We realize there are questions as to the government plan and measures to mitigate the impact of COVID-19 crisis. The economic team chaired by the Prime Minister and all state institutions are working on developing measures and plans to address this situation. The National Advisory Council for Economic Policies, chaired by the Prime Minister, and which include the private and the public sector's representatives, continuously study methods of economic recovery and submits recommendations that will be in the service that will serve the national economy. We have recommendations in relation to the tourism industry, which includes financial and tax facilitations for the tourism industry, and we shall announce any further decisions and measures that we arrive at in relation whether they are industry specific or generally related to all industries. This will be announced over the coming days and weeks. We also received questions as to why the Ministers' Council decisions on granting discounts on the land and the lower taxes for this and previous years. We would like to say that the reason for this is that we're going to modify the decision. So the discounts on levies will be expanded, and we're going to reduce the fines imposed for delayed payments. And this will facilitate things for enterprises and individuals, and this will be announced in a set of decisions that we'll announce soon. Before I conclude, I would like to say that yesterday we regretfully witnessed and received hostile comments in the time when the mass were broadcasted live on the different social media platforms. These comments were hostile, they're alien to our community, they are condemned and has no place and have no place in our community, and they are in fact criminally, they are criminal because they are hurtful to religious feelings. We're going to be firm and strict upon prosecuting anyone who uses hate speech or who offends the freedoms and the rights of people, religious rights of people. On the other hand, and this is a positive thing, the thing that in fact expresses the nature of our Jordanian community, after the decision to reopen churches and mosques, we've seen great humane initiatives where youth, Muslims and Christians volunteered to prepare churches and mosques to receive worshippers. In fact, this is the Jordanian nature, and these are the values that we all embrace. I would like to sincerely thank everybody who rejected this kind of offensive comments and who responded to them in a sense of wisdom and in a sense of the brotherly spirit that we all have in this beloved homeland. We have the Minister of Health, Dr. Jaber, who's going to tell us about the epidemiological situation, and who's going to tell us about the scaling up of tests in concurrence with the reopening of industries. We also have the director of the COVID-19 crisis cell at the National Council for Security and Crisis Management, Brigadier Al-Faraya, who's going to tell us about the repatriation plan and the mechanism of repatriating citizens through land border posts, and the reason why people will not be allowed to use their private vehicles upon coming back to Jordan through land ports. Good afternoon. In the name of God, today in the kingdom we had 23 persons who tested positive for COVID-19 to make the total number of cases 831 cases since the outbreak of the pandemic. The cases were distributed as follows: 11 are for people coming from abroad and they are in quarantine. All are coming from Pakistan. 6 cases of lorry drivers coming through border post. 1 of them is Jordanian. 6 are contacts of a person in the capital. This person tested positive for COVID-19 yesterday, and his house and his place of work were placed under isolation and quarantine, and we are closely following up his contacts. Today we had 20 recoveries to make the total number of recoveries 627 cases, and there have been no deaths as well. And I would like to mention here that recoveries in Jordan, the recovery rate in Jordan is one of the highest in the world, and in implementation of the instructions of His Majesty the King to scale up lab tests, the number of lab samples pulled today was 6,650 samples. This is a record number, especially in the context of the reopening of industries, to make the total number of tests since the beginning 28,778. And when you measure the number of tests per 1 million capita, Jordan, in fact, is one of the countries of high testing rates in the world. And in this framework, I would like to stress and remind everybody that the pandemic is still there, the threat is still there, and therefore we all need to comply with the preventive measures, and we need to stay away of crowded places because the threat is there, still there. Thank you very much. Mazen Bek, good afternoon. As for the repatriation of Jordanians, in fact, the number of people who registered with the electronic platforms for flights are 17,000 and 5,000 registered with the electronic platform for road traveler. Yesterday, 350 persons came through Nuweiba and they were transferred to the hotels of the Red Sea. Tomorrow, we're going to have 200 persons coming from Syria and Lebanon. And on Thursday, we'll have 150 persons coming from Iraq through Al-Karama border post. And from Saudi Arabia, we're going to have batches of travelers, 4 of them. There are going to be 1,550 persons out of 3,500 who registered applying for repatriation through the land border posts. As to flights, today we started the first one coming from the United States. There will be 18 flights coming from different countries, and we expect that the total number of repatriates through land and the airports, 5,000 is going to be 5,000 persons. As long as we have capacity at the quarantine sites, we will continue to receive repatriate citizens, and as long as the citizens wish to be repatriated. As to using the private vehicles upon coming through the land ports, in fact, this is particularly related to a passenger coming from Saudi Arabia. I've received lots of questions in this regard. In fact, this matter is not specific to KSA or specific to the expats coming from KSA. The reason why we prevented the use of private vehicles to come through the land ports, it's because the Ministry of Foreign Affairs will organize a repatriation of our expats through by buses. The groups coming are going to be students who don't have cars, and persons who were stranded abroad, like one who went to perform Umrah and they don't have cars, and those whose jobs were terminated and therefore they don't need to bring their cars with them. The other reason, in fact, the other more important reason is because of health and safety. Having all of these people coming through border posts, and they need to do the paperwork to contact and to create gatherings at the offices, and that will create contacts and gathering, overcrowdedness, which will allow the infection to start at the border post. Therefore, that will undermine the whole quarantine and the whole lockdown. The other thing is because of the delays. If everybody comes with their own car, we cannot control the time of their arrivals. That will create delays, and the same level of frustration that we have now is going to be there, but related to delays, and therefore this is something that we expect. One more thing is that those who wish to have to bring their private cars, if they are among our priorities, they're not supposed to be needing their cars, but if they wish to bring their cars, they can ship it. And the other thing, in fact, this applies to all countries. Those who from Kuwait leave their cars and come back, they sell it or they place it at the custody of somebody. I don't know why the focus a lot was on Saudi Arabia, maybe because we shared a border post with them. But the point is that we understand, we empathize with citizens, but I would like to say that our priorities do not include the cars of citizens. I think that the safety and health of 10 million citizens is more important than bringing the cars, the private cars of the expatriates. We're going to open the floor for questions, but please, if you want to take the floor, introduce yourself and mention the media outlet you come from. We received a question via email from Amoun website asking if the deaths in Jordan increased because of the deterioration in the healthcare and medical care, and because of delayed arrival of patients to the hospitals because of the curfew and the fact that only emergency cases are transferred to the hospital. I will leave this question to the Minister of Health. During the 3 months, over the past 3 months during the pandemic, we did not stop receiving patients at 100%, especially at major hospitals. More than 250,000 cases were received and 200,000 cases of emergency. And we distributed 200,000 medical prescriptions. We delivered them to the houses of citizens, and we are now analyzing data, the reasons of deaths, and statistically studying them in order to find out if there is increase. There are no indicators that there is a statistical increase in death rates. Many deaths, you need to analyze this statistically, because some deaths are the result of medical interventions. Maybe we're talking about major medical procedures. These result into a number of deaths, and our preliminary data do not indicate that there is an increase, but we're going to analyze the reasons of deaths and compare them to the same period of last year and the year before. Of course, we will compare it to the rate of visits in order to keep track of time, our time, yours, and the satellite channels. We'll ask every person to have one question only. If you're going to ask more than one question, we're going only to answer your first. Thank you.